Welcome back. Thanks for listening. I'm Ron Schakal, filling in for Tom Hutler with Shannon O'Kelly. Our next guest is Ryan Bahr, physician assistant in orthopedic surgery at Rainier Orthopedic, Puyallup, Bonnie Lake.
Yeah, Ron, Ryan is an interesting story himself. He's an amputee himself, and he's a physician's assistant in orthopedic practice. So he is one of those rare people that have experienced an amputation, but also advises patients, but very passionate about the Amputee Coalition of America and supporting these folks out there that have to have amputations.
Here's Ryan and Shannon.
Ryan, how are you? Welcome to the Health Talk.
Good. How are you?
I'm doing great. We know you're a physician assistant working in the orthopedic world. We also want to learn a little bit about your background, kind of your history. Today, we're talking about the patient care and work with Amputee Coalition of America. Ryan, you have a very interesting story. Tell our listeners how you became interested in becoming a physician assistant. You all have also have some medical history and very connected to the amputee and the amputee population. I want to learn about that.
I was born with bilateral club feet. My right foot was worse than my left. The first surgery I underwent was in 1995 or 1996. They had placed me in casts prior to that. My feet still were not going back to what they normally should look like. If you picture golf clubs, the putting green, that's kind of what my right foot looked like. And going through the years from birth essentially until teenage years, and then as soon as I turned 18, I'd had multiple surgeries on my right foot to try to correct the deformity, to repair torn tendons, and actually to try to allow me to do the things that I enjoyed. But in 2013 and 2014, it never seemed to get better. So I saw an adult orthopedic surgeon after becoming a transition from the pediatric world. And he presented three main options. The first was we can amputate below the knee and give you a prosthetic and see if that works for you. The second was we can fuse your ankle. You're young, so you're going to be in and out of the operating room until you're 80 or 90, because those only last about 10 to 15 years. Or we can try to revise what we've already done one more time. The back of my mind was, well, I've had enough surgeries. Let's just do the most definitive and be done, which was the amputation.
And you had that amputation in 2014, and that was an option that was given to you by an adult orthopedist. Where in this, I've got so many questions for you, Ryan, where in this journey did you personally become interested in being a PA? And make sure our listeners know you're now a physician's assistant in an orthopedic practice, at times caring for and advising people that maybe are just like you, looking or considering amputation for various reasons. Tell us about your training.
When I was in junior high and high school, I knew I wanted to go into medicine because of all my various experiences. I actually had at one point thought about becoming an anesthesiologist and then an orthopedic surgeon. And then after talking with all of my different orthopedic surgeons who essentially became my mentors, they said, you should really look into becoming an orthopedic physician assistant or a physician assistant in general. And then having shadowed many different opportunities throughout college, I chose the PA career. It really gives me an opportunity to be one-on-one with patients and spend the time that I need to really make a difference in their life.
Yeah, Ryan, I'm just here listening. I mean, I can only imagine that you have this level of empathy for any of your patients. I mean, anybody that's had that medical experience from their youth to young adulthood, then electing to have an amputation, you must really have a lot of empathy for your patients and understanding of their experience. I can imagine they feel that. I mean, that's part of what you give them, I'm sure, isn't it?
Yeah, a lot of the patients will tell me one of my biggest phrases, it's all about you and your quality of life. So regardless of whether a patient's coming in with a clubfoot like me, or in my case, I do a lot of total knee replacements, total hip replacements with the physician I work with, I look at the patient and I tell them, this is your decision on how you want to proceed, and it's got to be based on your own quality of life. I can give you the options, but it's really what is your personal goal in this treatment. If you want to live life to how you want to live it, it's your decision whether you go forward with surgery. And that's how I made my decision.
More with Ryan Bahr, physician assistant in orthopedic surgery at Rainier Orthopedic, Puyallup, Bonnie Lake, after this on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
Now more with Ryan Bahr and Shannon O'Kelly.
Ryan, again, thank you so much for taking time to join us here on Health Talk. And my gosh, what an experience. What a story you have. We kind of just in review, you're born with club feet, tried to have it corrected for many, many years, many surgeries. And finally, for quality life purposes, decided to have a below the knee amputation. As a physical therapist, I can really appreciate what that is like for a patient and trying to return to function. But tell me about the coalition, the Amputee Coalition of America. What is that?
The Amputee Coalition of America is essentially a group to help and reach out to those who have both traumatic or born with limb loss or limb difference. The word amputee is kind of a misnomer to a lot of people. It can mean various things. There are pediatric patients born without a limb, and by that, they are an amputee at birth. And then in contrast, there are adults like me or even older than me when I made my decision who undergo traumatic amputation or health-related amputation. And the mission of the Amputee Coalition of America is to reach out and empower people affected by limb loss or limb difference to achieve full potential through education, support, and advocacy.
One of the things that we talk about a lot on this show, Health Talk, is the advancements made in medicine. I know 34 years ago, I did a rehab affiliation when I was becoming a physical therapist as a student. How can I get involved? How can the general public get involved? I think this is fabulous stuff. Tell us how we can help you and the coalition, Ryan.
The biggest thing is it's a volunteer-run network with very few staff. So I became involved when I was right after my amputation. I started going to their summer camp. I went 2 or 3 years before COVID and then before PA school, essentially. And then last year participated virtually. But the biggest thing that we're trying to get out there is for patients to be their own advocate. And a lot of what goes through the limb loss and limb difference book of First Step, which I helped rewrite last year, is making people understand or helping people understand that they're not alone. And even if you're not an amputee or someone with limb loss, you can still help someone who is.
And how do I get more information, or is there someone I can contact if I'm a listener and I'm going, I've got to get involved? How do I get information on this?
So the easiest way to find the website is to go to amputee-coalition.org. And then there are multiple pages on there where you can see get involved or what is an amputee. And there's various tabs on there that can help you understand the goals and mission of the Amputee Coalition of America.
And this is something that you don't necessarily, and it's not required that you're a clinician. You can just volunteer and be a lay person, a non-medical person.
Correct. And even in the professional world for providers, they offer their limb loss first step guide to all of the facilities. And if you become a partner facility, they'll send it to you for free to try to help empower your patients.
That's fantastic stuff, Ryan. Ryan, it was a pleasure talking to you. It's awesome that you're doing something special and have that personal experience helping the Amputee Coalition of America. Keep up the great work, Ryan. Really enjoyed our time talking.
Thank you.
Thanks to Ryan Bahr, physician assistant in orthopedic surgery at Rainier Orthopedic, Puyallup, Bonnie Lake, and Shannon. That is quite a story. And the Amputee Coalition of America is a special organization.
Yeah, an amputee, Ron, when you have experienced that, it's a loss, right? You lose a limb. And, as a physical therapist, we're trained, and that's the areas we work in sometimes, is teach an amputee how to become functional again using a prosthesis, but it's also dealing with some trauma, when you lose a limb. So I'm glad the coalition is out there for these folks.